I'm Sean Jones with the Alzheimer's Association, and we are at the Ione Community Center. And I'm here, we're going to talk about the 10 warning signs of Alzheimer's. If you guys have any questions during this, please just let me know. I'd be more than happy to attempt to answer them. So my current role is I'm the Eastern Washington Program Manager for the Alzheimer's Association. So my main focus has to do with community outreach and really just trying to increase awareness around Alzheimer's and dementia. And so we'll jump into the warning signs. Again, if you have questions, please let me know. And so these are the learning objectives that we're going to try to focus on, okay? Can you hear me okay?
Yes.
Okay. So we're going to describe typical age-related memory, thinking, or behavior changes, recognize common warning signs of Alzheimer's and dementia, discuss the tips for approaching someone about memory concerns, explain the importance of early detection and benefits of diagnosis, identify possible tests and assessments for the diagnostic process, and name the resources that are available through the Alzheimer's Association. So this is just kind of a scenario that I'm going to describe for you guys, okay? So Mary is a 73-year-old widow who lives alone. She's a retired teacher who has always meticulously cared for her home. Her daughter Lydia has recently been noticing that laundry is piling up and junk mail and old newspapers are lying around the house. Lydia is the eldest of Mary's two daughters. She lives just a few miles away and she visits her mother frequently. Patricia lives in another state. She works long hours and she's not able to visit her mom very much. So she communicates with Mary and Lydia frequently via phone and text messaging. And so what on the screen right now is just kind of, it's a sample of kind of what you would normally see as kind of family text messages that you would send back and forth. So it says, worried about mom, she keeps losing things and the house is a mess. Probably normal to get a little forgetful with age. It's so unlike her, should we worry? Let's reach out to our old neighbor, Dr. Salloway. And so this is a video where Dr. Salloway is going to talk, so hopefully you guys will be able to hear this okay.
As we get older, cognitive problems become more noticeable for almost everybody, and it can vary from person to person.
Can you guys hear that?
With age, people have trouble coming up with the word they want, right when they want it.
I think it might be best if we just probably blow past the video, as I would think.
Dementia is the
Right.
umbrella term for an individual's changes in memory, thinking, or reasoning. More than 100 years ago,
Okay, so now we're going to actually jump into the actual 10 specific warning signs, okay? So the first warning sign, and this is the one that's most common, is going to be memory loss that disrupts daily life. Okay, so what are possible signs of dementia? One of the most common signs of Alzheimer's is forgetting recently learned information. Others include forgetting important dates or events, asking the same questions over and over, increasingly relying on memory aids, such as reminder notes, or family members for tasks formerly managed with ease. So what's a typical age-related change? Sometimes forgetting names or appointments, but remembering them later. One of the key distinctions, and this is a question that I get asked a lot, right, is there's a massive difference between a normal age-related change versus Alzheimer's or dementia. As we age, all of us, we get more forgetful. We forget people's names more often. It's more difficult for us to retain information than it was when we were younger. That's normal. That's a normal part of the aging process. If it becomes to the point where you can't retain any information and you're forgetting all sorts of key things daily and it's disrupting your daily life, then that's a warning sign. It could potentially be Alzheimer's or dementia. A lot of it, again, people think they're starting to forget names or they're starting to do this. Those are most likely simply just a normal part of the aging process and not anything to worry about. But it's something to kind of pay attention to if it's something that starts to get more and more prevalent and happens all the time. Okay, so the second warning sign is challenges in planning or solving problems. So what are possible signs of dementia? Some people may experience changes in their ability to develop and follow a plan or work with numbers, which may result in trouble following a familiar recipe or keeping track of monthly bills, difficulty concentrating, taking much longer to complete tasks. A typical age-related change is going to be making occasional errors when managing finances or household bills. One thing to keep in mind, right, is everybody is different and has a different baseline of if those were things that they were ever very good at to begin with, right? Because we're not gauging the competence of somebody. If somebody was never very good at managing their finances, it's not going to get any better when they have Alzheimer's or dementia. But you also have to understand what they were like prior to Alzheimer's or dementia to be able to gauge it properly. And so that's just something to kind of keep in mind. Number 3 is difficulty completing familiar tasks, okay? So people living with dementia commonly have difficulty completing daily tasks, such as driving to a familiar location, organizing a grocery list, remembering the rules of a favorite game. And a typical age-related change is occasionally needing help to use the settings on a microwave or to record a television show. So number 4, confusion with time or place. This is another one that's pretty common. So people living with Alzheimer's or other dementias can lose track of dates, seasons, and the passage of time. They may have trouble understanding something if it's not happening immediately, forget where they are or how they got there. And a typical age-related change is getting confused about the day of the week but figuring it out later. So again, this is a common theme if it's something that's happening consistently over and over and is really causing a major impact on that person's life, then it could be a possible sign of dementia. And another question that happens a lot is people want to know what's the difference between Alzheimer's and dementia, right? So dementia, that is the big umbrella term, okay? Alzheimer's is simply a type of dementia. It's the most common type. It's the one that you hear the most about, but it's just one of the 4 or 5 most kind of specific types of dementia. The other ones that you hear a lot about is Lewy body is one that has very similar, kind of looks like Parkinson's as far as the symptoms for it. It's much more kind of physically debilitating. And then there's some other types of dementia. But the way I like to tell people is that if you have Alzheimer's, you have dementia. If you have dementia, you're not necessarily going to have Alzheimer's. So just think of Alzheimer's, it's just a specific type of dementia. So number 5 is trouble understanding visual images and spatial relationships. For some people, having vision problems is a sign of dementia, which may lead to difficulty with balance, trouble reading, problems judging distance and determining color or contrast, which may cause issues with driving. A typical age-related change is vision changes related to cataracts. So number 6 is new problems with words in speaking or writing. So people living with Alzheimer's, they may have trouble following or joining a conversation. So they might stop in the middle of a conversation and have no idea how to continue, repeat themselves, struggle with vocabulary, have trouble naming a familiar object or use the wrong name. A typical age-related change is sometimes having trouble finding the right word. And if you've ever interacted with somebody that has Alzheimer's or dementia, right, you can be in a conversation with them and there'll be a point in the conversation where they will just stop. And it's clear that they're not able to find the word that they're wanting to say, right? And I think the initial inclination is you want to jump in and help them because you know the word that they're kind of searching for, but you really want to resist that urge and you want to try to allow them the ability to find the word on their own. So you have to be really super patient. And oftentimes, if you jump in too soon and you're correcting them and telling them what the word is, it can get them kind of agitated, or their anxiety will come up because they're already feeling, in their mind, they're like, well, why can't I come up with this word? Where is this word at that I want? And so it's a really delicate balance you have to strike. But just imagine how, put yourself in the shoes of not being able to find a word that you've said probably a million times in your life, and you're having a normal conversation, and then it's just gone and you can't find it.
The other thing that
So number 7 is misplacing things and losing the ability to retrace steps. So a person living with Alzheimer's may put things in unusual places. They may lose things and be unable to go back over their steps to find them. Accuse others of stealing, which may occur more frequently over time. A typical age-related change is misplacing things from time to time, but you're always able to retrace your steps to find them. And this is a super common one, right? And this is like an example that almost every caregiver can point to as an experience that they've had to go through is, the car keys are now somewhere different than where the person always thought that they would put them, right? And so they can't retrace their steps to figure out where they put the car keys. So part of the progression is ultimately they're going to land on, well, you stole the car keys, or you put the car keys away. Because they can't comprehend with the idea that they're not able to just simply retrace their steps and figure out where they are. So the accusation of stealing happens a lot with individuals with Alzheimer's and dementia, because they're struggling with the reality of, can I really be losing track of where these things are? Somebody has to be messing around or screwing with me, and somebody's stealing from me. And so that paranoia really, it seeps in, and it's something that is a really common occurrence, especially if you have a caregiver that is working a lot with an individual with Alzheimer's or dementia. So number 8 is decreased or poor judgment. So people living with Alzheimer's may experience changes in judgment or decision making. They may use poor judgment when dealing with money, pay less attention to grooming or keeping themselves clean. A typical age-related change, again, is making a bad decision or mistake once in a while, like neglecting to change the oil in the car. It's not like we all make bad decisions and judgment mistakes, right? Probably daily. And so hopefully we're not going to get judged for those, and immediately people will assume we have Alzheimer's or dementia because we're making some poor decisions. Again, with this, what you're looking for as potential warning signs is, how often is it happening? Is it super prevalent? And is it in ways that are concerning about somebody's safety, right? And so if somebody has meticulously cared for their hygiene and grooming, and they've always taken pride in how they dressed or how they looked, and then all of a sudden you're seeing a major drop-off there, that could be a warning sign of Alzheimer's and dementia. It could be a warning sign of somebody who's severely depressed. It could be a ton of different things, right? And we'll talk about this a little bit later. You always want to make sure you're ruling out what are some of the other potential causes for some of these behaviors. Because yes, these are warning signs for Alzheimer's and dementia, but they could also be warning signs of a variety of other health issues.
Way I count my house.
And more than anything else, I think what we're trying to do, certainly as an association, is we want to have the community at large as educated as possible when it comes to Alzheimer's and dementia, right? We're trying to reduce the stigma of it as a diagnosis and allow people to be more comfortable talking about it in a public setting, because at this point, with the way that our population is aging, we're seeing a lot more diagnostic information when it comes to Alzheimer's and dementia. And so the more educated we are as a community, and the more that we're able to reduce that stigma, just the more quality care and education people will have kind of surrounding the disease. So number 9 is withdrawal from work or social activities. So a person living with dementia may experience changes in the ability to hold or follow a conversation. So as a result, he or she may withdraw from hobbies, social activities, or other engagements, have trouble keeping up with a favorite team or activity. And a typical age-related change is sometimes feeling uninterested in family or social engagements. So prior to me taking this position, I worked as a case manager, and I would work one-on-one with caregivers who had a loved one with Alzheimer's or dementia. And I was working with this gal, and the biggest warning sign where she knew something was significantly wrong with her husband was they were like lifelong Gonzaga basketball fans. And the season started, and her husband wasn't interested, wouldn't watch the Gonzaga games. If the game came on and he was in the room, he would leave. And so all of a sudden he was utterly, disconnected and uninterested in something that had been like a lifelong passion of his. And you'll see that a lot. That's just one example, but if somebody is, they have been doing like model airplanes their entire life, or something that's really intricate or takes a lot of, thinking and cognitive ability, once that starts to go, they're going to lose interest in that hobby super quick. So a lot of times those are pretty evident warning signs that there might be something cognitively going on.
What are the lowest common?
So number 10 is changes in mood and personality. So people living with dementia may experience mood and personality changes, such as becoming confused, suspicious, depressed, fearful, or anxious, getting easily upset at home with friends or when out of their comfort zone. So a typical age-related change is developing a very specific way of doing things and becoming irritable when a routine is disrupted. As we age, there is no doubt that we get more regimented, right, and more kind of rigid in our personal structure and schedule, right? We like it a certain way, and so if it veers off of what it is we're normally used to, that can lead to frustration. That's extra heightened when you start talking about an individual that has Alzheimer's or dementia, right? And so that's another thing to be super mindful about.
Another early.
So again, any of these are things to just keep in mind, right? Somebody can only have one of these warning signs, and that could mean they have Alzheimer's or dementia. Somebody could have all 10, but in really small instances, and it might mean that they don't have Alzheimer's or dementia. So you really have to have a big picture understanding of the person you're dealing with to know whether or not it makes sense to get a medical professional involved, right? Because from the outside looking in, when you start talking about your husband or your wife or your parents, it's going to be the family and friends that have interacted with that person that know what that person's is like, whether or not they're seeing legitimate kind of declines in some of these areas, and if the warning signs are actually warranting additional sort of assessments. So interpreting signs and deciding next steps. Okay, so we're back to kind of the text chain here. So it says, did you look at the warning signs info I sent? Yes, but I still don't know. Mom's showing a couple signs, but not all the time. How do we know if it's serious enough to see a doctor? And they say, let's check with Dr. Salloway. Okay, so this is just a quick recap of the 10 signs. So these 10 signs, they're a guide to identify problems that may be related to Alzheimer's. Individuals may experience one or multiple warning signs in varying degrees, but they don't have to experience them all for there to be concern. If you notice any of these signs in yourself or someone else, it's important to see a doctor. And so we're going to talk a little bit just about the importance of early detection.
It's a very interesting phenomenon.
Okay, and we're going to talk a little bit just about the 10 steps to approach memory concerns. So this is just something to kind of keep in mind. Just imagine if you're, again, your husband, your wife, a family member, a really close friend. These are kind of the steps you would want to use if you were trying to see if they had an issue or not, okay? So step one is, what changes in memory, thinking, or behavior do you see? So if you had a friend, if you had a loved one, a family member, just think to yourself, what specific changes are you seeing in their memory, their thinking, or their behavior? Step two, what else is going on? In other words, are there extenuating circumstances that might be causing some of those issues, right? Are they taking a new medication? Is there some sort of life crisis that might have happened? Are they under stress? Are they depressed? You want to try to factor in, are there other things occurring that could be causing those that wouldn't necessarily be tied to some sort of a cognitive issue? Learn about the signs and the benefits of early diagnosis. Alzheimer's and dementia, like almost any illness in the world, right, is going to benefit from the early diagnosis. The earlier we're able to diagnose something, the better support and care you can get for that. So the longer we wait to get a diagnosis in place, the more difficult it becomes to kind of address those issues. So step four is, has anyone else noticed the changes? You never want to try to make a determination kind of in a vacuum where you're the only person who's doing it, right? You want to try to get other people involved. Hey, what have you seen? Have you noticed some of these things? Try to get some information from medical experts, family, friends. You want to try to have a consensus where multiple people have witnessed similar things, right? So you don't want to put all the stress and onus on yourself as the only person being the decision maker in those circumstances. Okay, so step five is, who should have the conversation to discuss concerns? And this is also, one of the big conversations that happens when somebody has Alzheimer's or dementia is, at a certain point there's the decision made, well, dad or mom, they probably shouldn't drive anymore, right? And so that ends up being a big conversation you have to have, because driving is, in a lot of ways, kind of our last freedom. It's our last true kind of feeling of independence. And so to take that away from somebody is very difficult to do. But when you talk about who should have the conversation to discuss the concerns, a lot of times people will include more family members than they need to have that conversation, because everybody wants to be involved. But you have to think to yourself, okay, does Uncle Jack, is he going to do well, right? I mean, is there something that causes friction there? Is somebody kind of a loose cannon and you're trying to have a really difficult, hard conversation? You can't count on this person kind of keeping their emotions under control. So you have to factor in, who can I include in this conversation that we're going to get the best desired outcome from it, right? Because you have to realize emotions are going to get kind of high, right? So you want people that are able to work through that. So although everybody might want to be involved in the conversation, doesn't necessarily mean that they should be. What's the best time and place to have the conversation? So the key here is focus on the things you can control, right? You can control the time of day that this meeting takes place, the location it takes place, minimizing distractions, only including the people that are going to make the conversation go as well as they need to. So focus on those things, because oftentimes, especially if you have concerns that somebody has Alzheimer's or dementia, well, maybe having that meeting at 5 or 6 at night is not going to be an ideal time, right? So maybe they do really well at 10 in the morning. Well, then that's when we're going to have our meetings, at 10 in the morning. So just really focus on the things you have the ability to impact, and that's going to give you your best chance at having a positive conversation. So step 7, what will you or the person having the conversation say? You have to go into these conversations pretty dialed in, as far as almost having a script that you want to follow. Now, it'll probably veer off it at a certain point, but you can't just willy-nilly go into this conversation without having a plan in place on kind of the things that you want to make sure you're really talking about. So just make sure that people are kind of prepared for the conversation. And I always tell people, you need to have a plan A, a plan B, a plan C. you have to be ready to kind of pivot to maybe a different strategic point or a different way to talk about things, because your first plan might not go as well as you were hoping. So you have to be kind of fluid in your approach. So offer to go with the person to the doctor. I mean, I deal with this all the time. Not everybody has the luxury of having a lot of family or friends in their lives that can help. And so oftentimes there might just be one person. And so you want to make sure that you're offering to go with that person to the doctor, because they might not have anybody else that can go with them. If needed, have multiple conversations. Okay, so a lot of times you're not going to get everything done in that one conversation. As we all know, life doesn't always work that way, so you might need to have maybe multiple smaller conversations to get the best desired outcome. And so step 10 is turn to the Alzheimer's Association for information and support. Okay, so we're going to talk a little bit about going to see the doctor, okay? So most people address concerns about memory, thinking, or behavior with their primary care physician. However, in some cases, the primary care physician will refer the person to see a specialist for further evaluation. So specialists may include a geriatrician, neurologist, neuropsychologist, psychiatrist, and psychologist. So a lot of times primary care physicians, they are uncomfortable with diagnosing somebody with Alzheimer's or dementia. Some still will, they'll do that, but others won't. Part of the issue that we run into now is there's such a massive waiting list, especially for seeing a neurologist, because there's only a couple neurologists that I'm aware of here locally that actually will deal with Alzheimer's and dementia. So, I mean, some of the families that I work with, they're on like an 18-month waiting list to see a neurologist. But I do think the other key point is a lot of people think you can only see a neurologist for a diagnosis of Alzheimer's and dementia. There's a lot more like neuropsychologists. There's a lot more of those than people think, especially in the Spokane area. And more often than not, you can see a neuropsychiatrist in a month or two is their standard waiting list. It's a lot better. So don't get so hyper-focused on that it has to be a neurologist. That would be great, but again, they're just, the waiting lists are so vast at this point that I would maybe look at some other options. Okay, so what are the benefits of early detection?
Number of benefits in early.
So, importance of early detection recap. So you want to pay attention to any changes in memory, thinking, or behavior that you notice in people. If you see changes that are unusual for that person, take action by having a conversation. Discussing these types of concerns can be difficult, so consider using the 10 steps to approach memory concerns as a guide, which we kind of walked through. There are a number of benefits to early detection, including the opportunity to plan for the future, explore treatment options, and participate in clinical studies. And that was part of the video, is what she was going to talk about, is a lot of people will be, when I talk about early detection, they'll be like, well, what's the point of even getting early detection for Alzheimer's or dementia? I mean, because what can really be done about Alzheimer's and dementia? Well, you know, they just passed a new drug, 4 or 5 months ago, that is really effective with symptoms for people that are on early stages of Alzheimer's and dementia. And I can honestly tell you that we're truly at the cusp of some major medical breakthroughs that I think will really happen in the next 10, 15 years when it comes to, if not potentially curing it, but at least offering some relief from some of the most severe symptomology of Alzheimer's and dementia. But at a minimum, just knowing allows you to put all of your family affairs in order. It allows you to talk to family, and there's just a ton of supports and resources out there to help with care for people that have Alzheimer's and dementia. So, you know, you don't want to shortchange yourself on how long of a functional life you'll still be able to live. Part of the issue is, right, it's a progressive disease, and with it being a progressive disease, you're not able to really track the symptomology, because you might maintain a certain skill level for years, And the next thing you know, the next day, it might kind of drop off the cliff, right? With a progressive disease, that's one of the most maddening and frustrating things about Alzheimer's and dementia, is there's just no way to really track that very well. But I think with all of these breakthroughs that we're gonna see with some of these upcoming medical breakthroughs, you're just gonna see a lot more symptom relief than what we're able to offer now. So I think that's really, really exciting. So here's a question for you. We're going to test your knowledge a little bit here, okay? So there is currently no way to diagnose Alzheimer's disease. Is that true or false?
Well, we have diagnoses of exclusion and diagnoses of inclusion.
Yes.
It would appear, far as I can tell from what I've seen,
Right.
there's no hard and fast empirical test that says absolutely you have Alzheimer's, but at least last I heard, they could narrow down the options for Alzheimer's until there's really not much else it could be.
So the answer is false to the question. So there are a number of assessments and tests that make it possible for healthcare professionals to diagnose Alzheimer's with a high degree of certainty. So to your point, you're absolutely right. So there's not a 100% definitive, but there are assessments in place where a medical professional can, with a high degree of certainty say, yes, you have Alzheimer's or dementia. Okay, and so some of the possible assessments and tests that they have, there's like laboratory tests, mental cognitive status tests, brain imaging, and cerebrospinal fluid analysis. I always struggle with that one. So do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia?
Say it again.
Yeah, say that again.
Hang on, let me go back. So do dementia-like symptoms always result in a diagnosis of Alzheimer's or another dementia?
No.
No.
According to what you said earlier in the program, it does not.
That is very true.
Someone could have,
And so that's kind of what we were talking about earlier, right? Is you want to make sure you're potentially ruling out anything else that might be causing that person's behavior, right? Again, as another example would just be a lot of times, depending on if there has been a recent medication change, depending on what some of the side effects are of that medication, they might be totally mimicking all of these warning signs that we've just discussed. So you have to make sure that you're ruling out anything else that it might be versus potentially Alzheimer's or dementia. So seeking a diagnosis recap. So the diagnostic experience, it's going to vary from person to person. Something other than Alzheimer's or another dementia could be causing the symptoms. Stigma and misconceptions about the disease, like believing that nothing can be done, can prevent some people from seeking a diagnosis. Okay, so what's next when the diagnosis is Alzheimer's?
Is that a question or a heading?
Oh, it's a heading.
Oh.
And so this will,
Goes on.
and so this just kind of leads into what it is that we at the Alzheimer's Association have available for people, okay? And so one of the big things, one thing I like to make sure everybody understands is, so the Alzheimer's Association, we're a nonprofit, okay? Anything that I ever do in the community, all the presentations that I do, we offer a ton of caregiver support groups. We offer memory cafes. What a memory cafe is, that's designed for the caregiver and care receiver to go together. A lot of times, once the individual has the Alzheimer's or dementia diagnosis, they really miss out on a lot of their previous kind of social opportunities. So the Memory Cafe is designed for social engagement and interaction, which allows care receiver and caregiver together to do something. All of those things, which we do a lot of those, all of those are totally free. If you ever see anything where the Alzheimer's Association's name is attached and there's money being asked for, then that's not the Alzheimer's Association. We're designed to be totally free. We're a community resource. Again, we're just trying to raise awareness around Alzheimer's and dementia. Some of the other things that we offer, we have a 24/7 helpline, okay, and I can give you this phone number, okay, it's 1-800-272-3900, and I can tell you that this has been an absolute lifesaver. When I was working as a case manager with caregivers, you can call this number at 3 in the morning. It's staffed around the clock with licensed clinicians, therapists, social workers. So I mean, I used to have caregivers that would call it every 2 or 3 days in the middle of the night because they just needed somebody to talk to. And you can talk to a therapist and they'll talk to you for hours. You can also do care consultations. So if you call that number and you're like, gosh, I think my grandma is maybe showing some signs of Alzheimer's and dementia, they'll do a full care consultation with you and ask you a bunch of questions and try to figure out maybe what might be some good next steps for you. So that 800 line, again, totally free. It's an awesome resource if you ever need it. I highly recommend giving it a call. Our website is alz.org. And so our website, again, it's a wealth of information and resources on there. If you ever go to that website because you want to know what's available locally, it'll list any of the educational presentations that I might have planned in the area. It'll list all of our local support groups. And one thing I'm really trying to do when I took on this position is we're trying to increase our rural outreach, and we're trying to increase support groups that we're offering in some of the more rural areas, because we already have 5 or 6 in Spokane. So I added one recently in Newport, and I know we're adding one in Colville, we're adding one in Pullman. So I'm trying to get more support groups out, not necessarily just in Spokane, but trying to get some that are more available to everybody in different rural resources. The nice thing is most of our support groups you can access via Zoom as well, so I mean there's Zoom links. So if you go on the Alzheimer's website, it'll have the Zoom link, it'll show you that'll be attached when it lists where the support groups are. But those caregiver support groups are a lifesaver for caregivers. Oftentimes that could be one of the only times that they're actually not working as a caregiver is being able to go into the support groups.
When I went to
And then some of the other things as far as people often ask what could they do if they want to get involved to help, with the cause as far as fighting Alzheimer's and dementia. So some of the things that we're always looking for is volunteers. So like all of our support groups or memory cafes, we rely on volunteers to assist with that. Because my position, it's actually paid for from a grant. Most of the program managers, their positions are grant paid. So we do really rely on volunteers. So whether you can spare a few hours a week or make a more significant time commitment, consider volunteering with the Alzheimer's Association. We also have advocacy options. So we spend a lot of time trying to advocate for more funding when it comes to research for Alzheimer's and dementia. So you can become an Alzheimer's Association advocate, speak out on behalf of the needs and rights of those that are facing Alzheimer's disease. We have Trial Match, which is, it'll show you, if you go on our website and click on Trial Match, it'll just show you any of the local clinical trials if people wanted to participate in those. Because again, we have to have people participate in clinical trials for there to be effective research to hopefully find, more effective ways and ideally a cure at some point. And then our 2 biggest fundraisers, we have the Walk to End Alzheimer's, which we just had in Spokane. That's typically always in October. And so that's the main fundraiser for the Alzheimer's Association. About 99% of the funds we get from that all gets put into research. I don't know if anybody's ever participated. It's a really great walk that they do Riverfront Park in Spokane. And then another thing that they just introduced is called the Longest Day, which I was thinking I could use the longest day right now when we were driving here and it was 4 o'clock and it was pitch black. So on the longest day, day with the most light, the summer solstice, raise funds and awareness for the care, support, and research efforts of the Alzheimer's Association through an activity of your choice. Cool thing about the longest day is it allows total flexibility. If somebody wanted to create a golf tournament fundraiser for the Alzheimer's Association, you can basically come up with any activity that you want. Because they just figured that they needed to have the ability for people to be kind of flexible and creative around that because they already had, their walk as their main fundraiser. So the longest day is another kind of cool way to get involved. So do you guys have any questions for me? And before I forget, these are the 10 warning signs that I went over. So these are just designed as, you can put these on the fridge. It's also got our information here on the back. It's got the phone number, the website, everything that I kind of talked about. So make sure you grab one of those. Those are really helpful. I do tell people, just because you know what the warning signs are, doesn't give you free rein to start diagnosing all your friends and family. But you can if you want to. But, be cautious with the information you've learned here.
Are the numbers, the numbers of people coming down with, for lack of a better term, Alzheimer's, are they on the rise? I mean, as an aggregate, as the population goes up, the numbers go up, obviously.
Right.
But as a percentage of the population, is that on the rise?
It is on the rise, but that's also because as a community, we're much more aware of what the signs are of Alzheimer's and dementia. So people are a lot more likely to get referred to a medical professional to get an actual diagnosis now. I don't think that there's no research that's showing that more people are getting Alzheimer's versus 50, 60, 70 years ago. It's just that the diagnostic process is much more prevalent and aware for people than it used to be.
And we're getting older too.
Absolutely, we are definitely getting older.
People are living longer.
People are living a lot longer, for sure, yeah.
What about any root causes? Have they isolated anything? I know for the longest time, people were saying it's the aluminum chloride in your underarm deodorant that causes Alzheimer's.
Right.
But I have no idea if that was debunked or not.
I
I use
don't,
it sparingly.
I don't think there's any factual evidence that's a cause. I mean, again, the number one cause of getting Alzheimer's or dementia is simply getting older, right? And so the other big issue is genetically, if it runs in your family, right, then you're more likely to get it. They did just create a blood test that I believe was just approved, FDA approved, 3-4 months ago, that will tell you within 90% certainty whether or not you have the genetic markers for Alzheimer's or dementia. And previously, before this blood test was created, I think the previous version they used was around 50% accuracy. So 90% accuracy that's a massive jump there. So I think that's just another example of, again, I think with all of the money that we're putting into research, I do think we're going to start seeing a lot more breakthroughs for things that will really positively impact the care of Alzheimer's and dementia.
My mother had dementia and she refused to take the medication. She was one of the old-fashioned RNs that knows everything.
Right.
And she refused to take the meds because of the side effects of everything.
Yeah.
The meds cause cancer,
Yeah.
What do you want to deal with, dementia or cancer?
Well, and I think the other thing too is, I mean, I will relate this a lot to, like when they first came out with antidepressants, there was only a couple of options, right? And side effects were pretty severe. And if you look at the amount of variety and different types of antidepressants you can take now, you can kind of base the antidepressant you want to take off of the kind of side effects that you can live with, right? Because there are so many different options. So I think the more medication options that come available, you'll also be able to kind of sift through the ones to find the one that has the least kind of restrictive side effects, right? And so again, the more money we're able to put in research, the more clinical trials that are done, the more different medical options you'll be able to have that can treat Alzheimer's and dementia. So again, I think we are really right on the cusp right there.
That's good.
I don't know if you mentioned this earlier, but it's something that just came in through a direct message. So there's 10 signs. At what point do you get worried? Like if you have 3, do you just kind of wait and see? If you have 6, 7, 8, is it like call the doctor tomorrow? What if you have the 10 checklist? What do you do? Like what's the tipping point?
Well, and again, this is why it's really going to hinge on how well you know that person, because it could be like my mom or dad, and if they only had one warning sign, but that one warning sign was massively severe, then that's all I would need would be one warning sign to know
I
that
see.
there's an issue.
Interesting.
So it's going to depend on the severity, really, of the warning signs. Because again, a lot of these, there could be somebody that has all 10 of these, but they're really, really mild, and they might just be the natural aging process. So it completely depends on the person and the severity of the warning signs. More than the number of warning signs, it's really more the severity of the warning sign itself that's going to kind of show you if additional assessments might be needed.
Do the 10 tend to follow a loose order?
Well, I think again, easily number one, the most common warning sign is going to be kind of the memory loss, right? I mean, that's the most traditional, it's the most, I think, obvious to probably be able to track as well if you were dealing with somebody. The way I always look at it is, I think a lot of people, I think they overthink their ability to analyze or tell, because I think most of the people that I've dealt with, especially caregivers, they knew almost instantaneously when their loved one was starting to show signs of Alzheimer's or dementia. I think it's really, if you've ever met somebody with Alzheimer's or dementia, because I mean, I think we're thinking about it now kind of in a vague conceptual way. If you have a loved one, I think once they start showing some of these warning signs, it'll be super evident to you that they need additional assessments. You can tell pretty clearly when somebody is starting to show signs of Alzheimer's or dementia. And this is a good little reference tool to have, but I think when somebody starts showing signs, again, because of the progression, it could just be one of these signs, but it could be really severe, that one sign. It could be 3 of the signs, maybe 2 of them are severe, 1 isn't. But I think you'll be able to tell day to day, there's going to be a pretty drastic change from what their baseline used to be. And I think the thing that you'll see that is always interesting is you might be the one that's taking care of mom and dad, so you're seeing them every day or every other day. And then somebody, one of your siblings who lives across the US, maybe they come in and they only see mom or dad every 3 or 4 months. And so a lot of times if you're seeing somebody every single day, sometimes you don't necessarily see how significantly they might have dropped off, where the sibling will come in and be like, gosh, mom is really, she's cognitively seems way off from when I saw her. And you might have been so kind of caught in the day-to-day minutia of things that you don't necessarily notice that. That's why it's always helpful to make sure that you're trying to not do all of it in a vacuum and take it all on yourself. You want to make sure you're including everybody else in to get other people's opinions. Hey, am I seeing this right? And to bring people in kind of fresh, to give kind of a fresh view of it. That's really important to do for sure.
I meet with a variety of people, and one case in particular I'm thinking of right now, her husband was diagnosed with Alzheimer's a year ago. And unfortunately in his case it seems to be fast acting. But she recently attended a similar workshop, and she said retrospectively, there were signs that she just didn't know.
Right.
And some of it too was he was much more unreasonable. But listening to you tonight, I realized that was probably covering up for the frustration of not remembering something, not being able to find the keys, not, those different things. Whereas when you're in the marriage, you just think, oh, he's just getting grouchier with
Right.
age kind of thing,
Right.
or she.
Yeah, for sure.
But how on earth to keep that, like the 10-point checklist, like ever present, so that people do see it and do gauge their partner without, like looking for it all the time too.
Well, and the way I look at it too is like, picture yourself like back when you were in school, right? And you get called on by the teacher, and you're like, gosh, I didn't study, I didn't read the chapter I was supposed to read last night. So that feeling of when you get called on and you don't know the answer to a question, oftentimes somebody with Alzheimer's and dementia, you will see them react with agitation, with frustration, with anger that maybe you've never seen from that person before. And a lot of it is because they're mad at themselves, they're mad at the world, they don't know how to show and process their frustration because they know this is a question they might have been asked a million times and they can't come up with an answer for it, right? And so the way I always look at it is that if you have a loved one or you interact with anybody with Alzheimer's and dementia, approach it with empathy, okay, with patience, and with a loving heart, and always realize that it's the disease speaking, it's never personal. And so whatever that person's behaviors are, whatever they say, whatever they do, it's not geared towards you, they're not lashing out at you, it's the disease that's talking. And so try to put yourself in their shoes and just realize how scary it would feel to all of a sudden have your cognitive skills diminish where you can't be the person you once were, right? It's terrifying. So just approach those individuals with empathy and patience and love, and you're more likely to have a positive outcome.
We should hang a poster on the wall with all 10 and a simple rule at the bottom, first 1 to 5.
First 1 to 5.
I like it. Be like a bingo card.
Yeah, but I know some people who would make up the symptoms. We're like, oh, I got that for sure.
Well, that's why I make sure I tell people this doesn't mean you can start diagnosing your wife or your husband just because you have your card now.
No, I'm card carrying.
But I do think it's really important just as a society that the more aware we are of kind of what the warning signs are, again, the earlier we can get people help, because there is help out there, and as we progress, there's more and more help that's going to become available for people. So just as a community, we just want to make sure we're looking out for everybody and doing our best to help where we can.
That's important. My mom lived with us for 6 months, and she was blind. That didn't help any, and she had at least 7 of those, and strong in them.
Yeah.
Except that when she went to a neuropsychiatrist, he did all the tests and said she doesn't have dementia, she doesn't have Alzheimer's. Don't know what's wrong with her, but it's not that.
Yeah.
But she had them all.
Right.
And when we worked with her the way you're supposed to work with somebody who has them all, it didn't really work.
Right.
But still, we didn't have a community. We couldn't find a community. No matter where we went, nobody knew of anybody who could help us, no communities, no support groups. It was so frustrating, and that was only 5 years ago.
Right.
So this would have been so nice.
Yeah. Yeah.
That was where I was with my friend. I think, looking back, that he probably had it 1.5 years before I recognized it. Because, first he couldn't remember what day it was, but I thought, well, he doesn't do a lot of things. He's just forgetting because he doesn't keep track of things.
Right.
And then they had to start, we started writing on the calendar, Monday, Tuesday, Wednesday, Thursday. Then he'd lose the list and couldn't find it. I mean, looking back, I think it was long before he had a stroke. They said it was vascular dementia. It's a little different, but they still have
Sure.
a lot of the same, they do the same symptoms as these.
Oh, for sure.
He loses keys, he thought somebody was stealing from him, you know, and he'd go to the post office. I took him every day to the post office, and he had a handful of keys, and he couldn't remember which one went into the mailbox, you know, and then I kept taking him for rides and taking him to the mailbox, trying to keep a routine
Sure,
to the end.
yeah,
And they didn't last very long, but people that have to go through this with family members for years, I do not know how they do it. You
Well,
know,
and
this whole year that I went through
Yeah.
with this guy was just, we
Well,
were
I-
just good friends, you know, and I was just trying to stay a good friend, and it was just, it was,
Well, and what's tough, right, so I mean, again, back to when I was working as a case manager, I mean, there's a lot of times where, you know, somebody will get diagnosed with Alzheimer's and, you know, they might pass away 3 months after the diagnosis. I mean, there was 1 month where, you know, caregivers, I had 4 or 5 that lost their husband or wife in like a month period. And a lot of them had only recently been diagnosed with Alzheimer's. or
they had other
dementia.
diseases probably though too, didn't they?
Probably, and a lot of it was probably undiagnosed. The Alzheimer's and dementia went undiagnosed for a long time because maybe the warning signs, maybe they just weren't aware of what the warning signs were, and they just were taking it again as maybe they just thought it was the normal aging process. But it's, yeah, it's just, again, all we can do as a community is our best to educate everybody as best we can. And also, again, I say this a lot because it's important to me. We have to just reduce the stigma attached, not just to that, but almost any disease, right? Or addiction, or mental health issues, just all of that. The more comfortable we are as a community talking with our neighbors and our friends about these things, then the more help people can get and not feel shame because of something that's labeled this or that. And so the more community forums we're able to have, the more comfortable we are talking about it, the better it is for everybody.
He wouldn't go to the doctor. He was supposed to be in heart medicine, and he didn't take it, and couldn't get him to the doctor all the time. 7 years I knew him, he didn't go to the doctor. I finally got him to the doctor, that, you know, he wouldn't go to the specialist that he was supposed to go to, so